Okay, for the last couple of months, the world has come to a standstill due to COVID-19, which is an infectious disease caused by the newly discovered coronavirus. Coronavirus has so far claimed the lives of more than 15,000 people across the world. According to World Health Organization, most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. Let's take a look at the President's speech about this pandemic.
We are currently also working on other initiatives to support our private sector during this particular difficult time. Most importantly, to ensure that they are able to continue to pay our hard-working Kenyans who have been employed by them. But we would also encourage that our companies and businesses do also that which they can to work with us and to support government during this particular period. The use of technology will increasingly become important. Only yesterday, the Kenyatta Diagnostic Center here at Kenyatta Hospital, where we have the CT scan center, we did, and it was the first to happen on the African continent using technology. They were able to remotely conference with 3 centers in China, one in Egypt, another in France, and also with Eldoret, Moi Referral Teaching Hospital, where they were able to exchange with professionals and clinical officers across the world to share both experiences and practical ways in which we can defeat this virus that is upon us. So the use of technology will continue to become increasingly important as we move forward. More updates on the state or our current state of the virus will be given later by the Ministry of Health in their regular daily briefings. But at this juncture, I cannot but continue to emphasize the need for each and every one of us to follow the protocols that have been laid out by the Ministry of Health. Most importantly, with regard to the danger posed to our population by people who flagrantly refuse to adhere to the laid down protocols. I want to once again and categorically reaffirm that the government will take the severest action against any individual who knowingly breach these laid down conventions and procedures, and in turn put the rest of the population at risk. So I encourage you, each and every one of you, let us follow the guidelines as has been given by the Ministry of Health. Let us be our brother's keeper, let us be our sister's keeper, and I am sure that if we do this, we shall overcome this particular pandemic. As I said, in a few days' time, we shall also be having a further session with private sector where we shall be announcing a raft of measures that the government will take to support our businesses and to support our people during this particularly difficult time. I thank you all, and thank you all for coming. Asanteni sana. Thank you.
The Deputy Governor of Kilifi County, Gideon Saburi, who arrived from Germany, tested positive after refusing to self-quarantine himself. The Deputy Governor is allegedly said to have met with many people and even attended events like funerals. He was forcefully taken to hospital yesterday for isolation. The Cabinet Secretary for Health, Mutai Kagwe, said that the government will charge anyone who fails to comply with government orders.
Consequently, NAC has decided that all persons who violate the self-quarantine requirement will be forcibly quarantined for a full 14 days at their cost and thereafter arrested and charged in accordance with the Public Health Act. And I would like to add here that this will apply to a senior government official in Kilifi who defied and refused to self-quarantine, who is now being forcibly quarantined in a facility, and upon the completion of the period given by our health authorities, the person, the official, will be charged in a court of law. And this will be followed by each and every person who violates this.
Kenya's economy largely depends on the agricultural sector, with tea and coffee exports being the most important drivers. The second most important engine of Kenya's economy is the tourism sector, hospitality, and the entire service sector, which relies on people moving and getting services in restaurants, hotels, and shopping malls, among others. A shutdown has a direct hit. The COVID-19 nightmare is threatening to cause a global recession, whose impact will be felt in Kenya in the weeks to come. The virus also came with new opportunities for players in the pharmaceutical, e-commerce, and manufacturing industries. Those in the retail sector, especially e-commerce, have already started experiencing spikes in sales, mostly occasioned by panic buying. Mobile money transfer companies and banks are also likely to see their fortunes rise in the period. Stay tuned for more, subscribe to the channel, and also don't forget to sanitize, wash your hands, stay safe, stay at home. Thank you.